Hi, I'm Jason Denny. I'm the director of the Center for Living Donation. I'm also the surgical director of the Living Donor Kidney Transplant Program at Henry Ford Health. When you're called in for a kidney transplant, you will go to the H6 floor and be tested for COVID-19. If the COVID-19 testing is negative, you will proceed to the preoperative area, where you will meet your surgeon and anesthesia teams. There, you'll complete your pre-transplant testing. If you need dialysis, that can be done prior to transplant. The surgical team will check the transplant kidney in the operating room. If it looks okay and you look okay, you will proceed to the operating room for 4 to 6 hours. You will be given general anesthesia. The typical kidney transplant incision is near the right lower abdomen. During the operation, your native kidneys are not removed. A third or fourth kidney will be placed in the front of the stomach, usually on the right side. The native kidneys will continue to atrophy or shrink and get smaller over time. The surgeon will create an incision and find the blood vessels that run to and from your leg, as well as a bladder. The surgeon will implant the kidney. The kidney transplant can also be done with the assistance of a robot, which results in smaller wounds and reduced wound complications. There are 3 main connections made during the transplant of the kidney. The first and second surgical connections are between the transplant renal vein and artery and the iliac vein and artery. This returns blood flow to the transplant kidney. The ureter is the tube that carries the urine from the kidney. A third surgical connection is made between the transplant ureter and your bladder to drain any urine that the kidney produces. A drain is placed near the kidney to drain any fluids that collect around the kidney. We will be watching the amount and character of the drainage. We can remove the drain once we are happy with the quality and the amount is less than 100 milliliters in 24 hours. A stitch is placed over the drain site at the time of removal to prevent the drain site from leaking after the drain is removed. Sometimes it is necessary to send you home with your drain. In this case, you will be taught how to care for the drain and empty and record its output at home. If you are sent home with the drain, you will need to keep the site clean and dry. Often a stent is inserted between the ureter and the bladder. This stays for about 3 weeks while the surgical connection between the ureter and the bladder heals. A drain is left inside at the time of the surgery near this connection. The drain can help remove any excess fluid from the area around the new kidney transplant. Output from the drain can also help identify if there is a leak, a complication where the urine is leaking through the connection. This occurs in approximately 1 to 3% of patients. The stent is removed by cystoscopy, an outpatient procedure which does not require general anesthesia.